As you are aware, we as a hospital are to serve the needs of the clients in our catchment area. So when the project pilot phase was launched, the results gave us a picture of the needs. Our expectations were high because what we needed was to improve our services. We needed to provide quality services to our clients. So we're looking forward for any information that would give us what our clients need. The tools are helpful, like citizen reporting card, whereby we are able to get the actual information from the community.
It's easy as a hospital to just look at what's happening at your institution and thinking you're doing a good job, but perhaps the community's perspective is different. So we hope that this would give us feedback as to how we're perceived outside the institution and maybe correct some of our blind spots. I mean, the basic tool of gathering information from users and letting them freely express what they think about the service is very valuable. I think we don't know yet how valuable it is until we can make some corrections and then have a survey redone and see if our perception has changed. We need to look into what people weren't satisfied with, and then we need to devise a plan to see how we can improve that.
Basically, it was a M&D process whereby I wanted to have instant feedback from our clients if they are satisfied with the services. We were looking at quality as well as accessibility of the services.
My name is Geoffrey Kudzala Milans. I'm working as a health service assistant at Kampata, at the Health Center there, Kampata. The aujemera bwino ali pakafukufuku kuunika kufufuza za mmene anthu akuthandizikira pa chipatala panopa. Ndeno ndine zimayi mmodzi mwa azimayi amene akusankhidwa kuti atengepo mbali pakafukufukuyi. Ndesi ndikudziwa kuti ndinokonzeka kuyankha mafunso. Zikomo kwambiri. Ndiye tikhoza kuyamba? Zikomo. We are trained how to collect data. Some they are feeling free. They are answering the question. Some they are failing to answer because they are afraid. At first it was difficult, but after they are welcome the idea or they are participating in this program.
Chimata filiawa zisadafiki. Nayo dwala kudzadilira ndenda jira mwana wamkazi. Kizini pangira zomwe chimapangaso. Kunali kuyenera chifukwa amafuna dziwe ndi mmene muli munthu mwanga.
Ine ndine Fazila Malamulo. Napita mwezi wathawu. Ndadwala matenda amimba. Ife timaona kuti timafuna tikapita ku chipatala kuja madokotala atithandize mofulumira.
Ine ndine Aileen Mike. Ndidali ndi vuto la mimba mukangobwereka satotsekula. Kuti ndikapeza chithandizo ndimalipira ndalama. Ndiye ndalama imakhala yokulirapo. Siyani ndimene ndimapezera ineyo. Atati yapetserako bilu ya ndalamayo.
Dzina langa ndina Mariana Jamikele. Mbali modzi apa pamandiwa ndikafuna tona dora urande jambule. Senda khotisibye ifwa soda ndijambule. Lidafunikira ifwa yanga si yo dzemene nduvera ndenda aforozera kuti ndimavaba pamawawa ndi yodanene kurai. Mari murani tsono kurai mari ndijambule.
Ndine Joyce Hesrin. Ekina ndifusapa. Ngothandiza ifwa yori odziwa mmene umuntu umvera kuti ndipatse ithandizo yokwanira.
Ine dzina langa ndine Oliveta Chiganda. Ine kwenikweni ndimafuna manesi azikhala omasuka kwa anthu odwala ngati ife tikabwera. Komanso azitipatsa thandizo moyenerera.
Mwagwiritsa ntchito chani mmene mumabwera kuno? Njinga ya kapalasa ya ambulance bicycle, ambulance, wheelbarrow ngolo njinga yakapalasi mwagwiritsa ntchito chani mwayenda pasi chabwino. I've received a training of how to collect data about Uchembere network. I have done it in 2010 and this is 2011 for the second time. At first they were hasting and then after explanation they convinced and they give information. People, they revealed some of the problems here where they're failing to do, and then maybe they're going to correct it through the questions and the answers from the community.
This tool is a very good tool because it gives an immediate feedback and it helps to implement the changes immediately. There should be an assurance of privacy because people would not be free to talk of the negative things about the services. So
we communicate as soon as we have compiled the reports as well as the findings, and then we give it to the hospital management for them to take action on the points that the clients do raise.
And in that report there were some recommendations of which some the management has already started implementing and is also in a way to continue implementing the remaining ones.
One of the things I remember was that some of our staff, particularly the nurses who were to be giving education to pregnant women, were considered not to be very friendly. The time it took to get here was longer than what we had thought. In terms of cost, there were a variety of answers, and we were a little surprised because we thought most of the women might have been covered under the service level agreement so that they wouldn't have to pay. But I think the major reaction was we need to look into what people weren't satisfied with, and then we need to devise a plan to see how we can improve that.
Yes, after giving the feedback to the interviewers, the women have profited because we had a problem, transport problem, and after giving them our problem to the management has provided us with bicycle ambulances. So the transport problems has been eased, so that women are able to be taken to the hospital without problems.
The clients have already started experiencing the changes. For instance, another point that was raised was about the distance, that they are walking a very long distance to come to this place to access to Nkoma to access the services. As a result of that, the management of Nkoma bought bicycle ambulances to help cover the distance and transport problem to the communities.
The feedback that we got, we felt that the people need to be supported in areas of transport. And also the services that we are now offering, we are offering in line to what we got from the catchment area. The people gave us information of what our services were lacking. We thought we were just offering the best of our services. We never knew we are lacking in some other areas, whereby this report, the feedback that we got, has helped us to know which areas we need to check on.
As of now, I think we have started seeing change because people have started appreciating for the services after we had the CRC survey. I think with the introduction of the integrated services, people are not waiting for a long time, and then I think they're really appreciating because of the CRC.
We were just offering without realizing that there are some other services that we need to offer. But now with the reports that we got, we have seen that we need to improve in our quality. Let's say, especially how we handle expectant mothers. That area, the rate of which has now completely changed. Survival. We have seen a lot of mothers being supported and being given the treatment that they are supposed to be given as compared to the way it was previously.
This methodology could also be used at community level because we are using it at health facility level where we've seen the integrated of the sexual reproductive services, whereby we have the family planning, the antenatal clinic, the under 5, the HTC, bring them into one. So I think if we can also use it at community level to measure the impact so that maybe we can meet our objective.
There have been women's groups that have been introduced in the communities to to pray as a base for further information about antenatal and child health.
And we know that the way that happens starts in the village, with education there, and then making sure it's possible for women to get quick access to care at every level.
And we as decision makers has really helped us in our offering of services to the people. What we got is very encouraging, and we have also seen the response from the people that they are now appreciating the services, and we look that this will go on.